Hello everyone, I am Dr. Sedat Duman. Today I would like to talk about one of the most common questions I receive in limb lengthening surgery, the combined LON method. If you are researching limb lengthening and want to understand the whole process, including its benefits and challenges, this video will give you a clear overview. Let's get started. What is the combined or LON method? The LON method, lengthening over nail, combines two systems, an intramedullary nail placed inside the bone and an external fixator attached outside the leg. During surgery, we make a controlled cut in the bone, insert the nail, and then apply the external fixator. This combination gives us the stability and control we need for safe lengthening. Thanks to this setup, patients can start walking with support from the second day. The bone stays in good alignment and healing progresses in a more predictable way. Why do many patients prefer the LON method? Let me explain this based on real clinical experience. First of all, it feels more stable and safe because we use both an internal nail and external fixator. Patients feel much more secure when they are walking. With LON, patients are able to stand and walk earlier, protect their muscles and joints more easily, and feel more confident throughout the process. With internal-only method like precise or fit bone, we usually move a bit more cautiously in the early weeks. Secondly, patients can continue lengthening in their own country with LON method. This is one of the biggest advantages of LON. If a patient lives in a country that is only a 2-3 hour flight away, they can usually return home about 1 month after the surgery and continue the lengthening phase at home. Many patients choose this option because they feel more comfortable with their family. The process becomes mentally easier and they stay more motivated. Of course, we stay in close communication, online checkups, reviewing X-ray, adjusting the daily lengthening schedule, and giving quick guidance if something feels different. We haven't had serious problems with any patient who choose to go home. But those who want to stay in Istanbul for the entire process are always welcome. It's completely personal preference. Many patients get mentally tired during the long lengthening period. Being able to continue treatment at home really helps them stay positive and relaxed. Thirdly, LON method works well for both femur and tibia. From my own surgical experience, LON is very effective on both femur and tibia, but the tibia is often more comfortable for the patient. Why? Because of the fixators on the femur. The patient cannot comfortably turn to the right or left while resting or sleeping. And as the days go by, this starts to bother the patient more and more. Additionally, the fixator sits closer to the bone in tibia. The lever arm is shorter and the lengthening feels more stable. The method works beautifully on both bones, but the technical details differ. The next important topic is the risk of pin site infection. The most common issue people talk about in LON is pin site infection. But with proper daily care, correct wound cleaning, and timely medication when needed, these situations are usually handled very easily. When patients follow instructions, the process is typically smooth. And what about the pain? Is the LON method more painful than other techniques? Yes, slightly more painful, but manageable. Compared to precise, LON patients describe a bit more discomfort. This is mostly because the external fixator interacts with soft tissue. However, good pain control, regular physical therapy, and consistent follow-up make discomfort very manageable. For me, the most important point in the LOM method is that This technique requires a higher level of surgical experience. This is an important point. LON involves many details: nail fixator coordination, shank pins angles, osteotomy level, soft tissue tension, and alignment during lengthening. This means the surgeon's experience plays a major role in the final outcome. Internally only methods like precise and fit bond are technically more simple. LON, on the other hand, requires planning, precision, and a personalized approach. If we take a step-by-step look at the limb lengthening surgery process with the LON method, on the first day, we perform the surgery. The intramedullary nail and the external fixator are applied. On the second day, the patient can start walking with support. Between days 5 and 7, soft callus formation begins, which means the bone has started its healing process. We usually start the lengthening phase around the 5th day after the surgery. The lengthening is done at a rate of 1 mm per day, divided into 4 small steps throughout the day. So, to gain 5 centimeters, it makes about 50 days. To gain 8 centimeters, it takes approximately 80 days. When the target length is reached, we remove the external fixator, lock the nail, and bone healing continues, usually faster, thanks to early walking. In summary, the LON method offers a stable and safe walking experience, the option to continue treatment in your home country, reliable results with an experienced surgeon, a more accessible overall cost, a strong mechanical system, faster healing with proper rehabilitation. If you are exploring limb lengthening, the LON method is definitely a technique worth considering.